any student, again, regardless of orthopedic impairment or not, would require a healthcare plan to be added if there's an underlying medical need that would impact them educationally or could impact them. So, like, for example, a student with asthma, even if if they're required to have an inhaler on site, then they would need a healthcare plan. A student with allergies, if they're required to have an EpiPen on site, then they have to have a healthcare plan. So for a student with orthopedic impairment, if there's any medical condition that significantly impacts their ability to access, if they require G-tube feeding or suctioning or anything like that, they would require a healthcare plan as well as the health and nursing services, of course, to ensure that there's that training, and that there's always somebody available in the event whoever has been trained isn't available to support that student so they can come to school. Excuse me, come to school. If there's any need for a medication administration on site, they would require a healthcare plan. Or again, if that medication needs to be kept there in the event of. If there's any need for monitoring of symptoms, um, that would require a healthcare plan. So, for example, um, if a student, I had an IEP yesterday that if anytime there's any impact to the head, they have to be monitored, like that would require a healthcare plan. And you would delineate what to look for and when to take what action, right? Um, so I think in a nutshell, that's really kind of the bigger answer. I mean, as far as how the healthcare plan would be written, that would obviously be dependent on that individual student.